Hello everyone, welcome back. In this video, we are going to learn the gluteus minimus muscle. So, it is a group of superficial gluteal muscle. So, starting with its origin and insertion, the gluteus minimus is the smallest and deepest of the three gluteal muscles. So, it lies underneath the gluteus medius muscle. Gluteus medius muscle, I'll explain in the next video. So first let's look at the origin point. The gluteus minimus originate from the external or the gluteal surface of the ilium, especially between the anterior and inferior gluteal lines. So now let's move to insertion. It is inserts into the anterior surface of the greater trochanter of the femur. Okay. Then for easy way to remember, it get originate from the gluteal surface of the ilium and inserted to the greater trochanter of the femur. Okay, now let's learn the nerve supply, arterial supply, action and daily activities of the gluteus minimus muscle. So first is nerve supply. It is supplied by the superior gluteal nerve, okay, that is L4 to S1 spinal nerve root, and then arterial supply by the superior gluteal artery. So superior gluteal nerve and superior gluteal artery. So actions, this abducts the hip and it also medially or internally rotates the hip, and another important function is they stabilizes the pelvis during walking and while standing on one leg, help to keep the pelvis level during gait. So in daily activities, it helps for walking, running, climbing stair, standing on one leg, side stepping, and maintaining a balance during movements. So these are all the now supply, arterial supply, main actions, and daily activities. Next one is applied aspect. So first one is this muscle gluteus minimus weakness may causes your Trendelenburg gait. Okay, when the gluteus minimus is weak, the pelvis drops on the opposite side. So during the stance phase of the gait, at that time you can see Trendelenburg gait. Then second one is superior gluteal nerve injury, because superior gluteal nerve supplies the gluteus minimus, right? So if injury happens, definitely pelvic drop on the opposite side can occur. Then pain and weakness, patients may experience pain and weakness in the hip during walking or standing on one leg. Okay, then next one is hip instability. Weakness of the gluteal minimus reduces the dynamic stability of the hip, so leading to instability during functional activity and sports. So that means if you are having a weakness in the gluteus minimus muscle, so its main action is to stabilize the dynamic stability of the hip, right? So that if there is no strength in this muscle, then how it helps for your dynamic stability? So that's why there is a limitation. There will be a limitation in the functional activities in the hip joint. So next one is special test. A special test. First one is Trendelenburg test. Its purpose to assess the strength of the gluteus minimus and also the gluteus medius. So if the test is positive, when standing on one leg, the pelvis drops on the opposite side, so indicating weakness of this hip abductors. So if it is normal, the pelvis remains in the level. Second one is manual muscle testing. So gluteus minimus manual muscle testing, it's actually purpose to test hip abduction strength. If grade 5 means a full hip abduction against the maximum resistance. So how it performs, the position of the patient is side lying, the hip is abducted and the examiner applies downward resistance at the ankle. So at that time, if the patient holds the leg in full abduction against the maximum resistance through the full range of motion, so this is normal. Okay, so these are two main special tests and there are more, so I only choose two. Okay, so every part is done: the origin point, insertion point, nerve supply, arterial supply, action, daily activities, then special test and applied aspects is done. Now let's remember them in a small mnemonic called mini. So M stands for medial rotation, the gluteus minimus medially rotation of the hip, right? So M stands for that. Then I stands for internal pelvic stability. That is, this muscle stabilize the pelvis during a single leg stand, right? So keep the pelvis in the level. So it works like that. Then N stands for the nerve supply, that is superior gluteal nerve, and I stands for the insertion, that is greater trochanter. So remember them as a mini word. Okay, so now revise whatever we studied right now. So this muscle, it is a deep hip abductor and medial rotator that stabilizes the pelvis during single leg activities, and it comes under the superficial gluteal muscles. So origin point, it originates from the gluteal surface of the ilium and insertion to the greater trochanter of the hip. Now supply by the superior gluteal nerve, blood supply by the superior gluteal artery. Then action is, it abducts the hip and medially or internally rotates the hip. Then stabilization of the pelvis during single leg standing. Then daily activities, it helps when while walking, running, or standing in one leg and side stepping and balancing during the movement. Then applied aspect, we studied, that is weakness in this muscle may causes Trendelenburg gait. Then superior gluteal nerve injury, then pain and weakness during this, and hip instability because of weakness in this muscle. Then special test, we what that Trendelenburg test and manual muscle testing. So easy way to remember them is mini, where M stands for medial rotation, I stand for internal pelvic stability, N stand for nerve supply, that is superior gluteal nerve, and I stands for the insertion, that is greater trochanter of the femur. So this is the end of this gluteus minimus muscle. In the next video, I'll explain gluteus medius muscle. So thank you for watching. See you in the next video.